Welcome to the office.
Buenos días.
Buenos días.
Mucho gusto.
Igual.
Igual. ¿Qué tal?
Me da mucho gusto
Gracias.
conocerlo.
¿Qué tal?
Bien.
Bien.
Bien mal.
¿Dónde le duele más? Why is Mama here? Welcome to the office.
Thank you.
All right. Talk to me.
So she's had a lot of falls throughout her life.
Okay.
But
Where are you guys coming from? You guys are local?
Yeah, we're local.
Okay.
Yeah, we're nearby.
Now, who found me?
I found you.
You found
Yes,
me.
I found
Or
you.
you were going down the rabbit hole on YouTube?
Oh yes,
Okay. For your mom.
for my mom.
Mom's in pain.
Yes, you gotta fix it. Hopefully.
Okay. What's going on? Tell me.
So it's been I believe a year already where her pain is just getting worse and worse after a
What
fall.
pain?
A pain on her low back.
Okay.
So it's her glutes, all to her legs, to her feet,
Okay.
and some down to her arm as well.
And this all started when?
A year and a half ago after a fall at work, but she felt fine, and then
What
months
you doing at work?
housekeeping.
Okay. So she was standing when she fell. She was going downstairs. How did she fall?
She was cleaning the bathroom, and I guess because it
Okay.
was wet, and she flipped and she landed on
On
the
her
hip.
right hip.
Yeah, it's la derecha o la izquierda, ma?
Esta.
The right
That's
one.
the-
Yeah.
Okay. So she landed on her right hip.
Mhm.
Year and a half ago.
Yes.
Okay. Any X-rays taken? Was she out? Was
No, she just went back to work with with like some pain.
Okay.
Yeah.
They're tough.
Yes.
Yeah, they're tough. They endure a lot for us. Yeah. Okay. So she just kind of went through it.
She went through it, yeah, but she's had falls prior to that, like
Yes, she has.
2-3 years ago, and she's also maybe like 15 plus years of like like physical abuse, just being thrown,
Okay.
and like I believe that's what
That's what started it.
I think.
Because
so.
when I'm looking at her spine, this stuff goes back like over 30, 35 years.
Yes.
This has been going on for a while. Okay, so
Okay.
she's had a lot of physical traumas.
Yes.
I can see that
Yeah.
on the X-ray.
Mhm.
Okay. Is she still going through those
No.
physical traumas? Is that stuff done? Are you okay?
Mhm.
It's emotional. You have to deal with it. You probably have to experience and be part of it. How come she's not crying?
She's strong.
She's strong. Where are you guys originally from?
My mom's from El Salvador.
Salvador!
Mhm.
Very nice. I used to go to El Salvador and do mission work there, Chiropractico.
Oh.
I've been to San Salvador 3 times and San Miguel.
Mhm.
Oh, that's where she's
And-
from.
San Miguel?
Mhm.
So Liceo San Miguel, I have a TV, I was on Buenos Dias Oriente,
Oh.
which is in San Miguel.
Mhm.
And Buenos Dias Oriente, we were doing a mission. This was way back when. This was early 2000.
Wow.
And I led a mission to San Miguel. There was just 4 of us. And I ended up, me and one of my colleagues ended up taking care of the school, Liceo San Miguel. And one of the, I'm just sharing a story. And one of the, because when I hear it, it brings good memories back. So I was in the middle of adjusting and a driver showed up and says, "You need to come with me."
Oh.
And we're like, "Where are we going?" And so I guess one of the kids told his mom, and the mom owned the TV station
Yeah.
that was filming Buenos Dias Oriente. So I did a whole talk on chiropractic for the country.
That's great.
Yeah, that
I'm
was
gonna look into it.
2003. 2003. Beautiful place.
Mhm.
Great pupusas. I like my
Love
pupusas. I like them. Okay, so let's rewind. Sorry, you took me off to a tangent. So, mom's working hard. She's working hard most of her life.
Yes.
She's had some physical stuff go on,
Mhm.
a lot. And why now?
Reason now is because she can't walk anymore. Like it's painful.
Is she
But
working?
She's working. She went from 6 days to 3 days.
Wow, okay.
Yeah, and since we came here, I actually told her workplace that she'll be taking off 2 weeks because I just want to make sure like she's just relaxed while this whole process.
Okay, so we have a couple weeks to figure this out.
Yeah.
Okay. And the idea is going to be this, okay? That whatever happened a year and a half ago, or even a few years back, work
Yeah.
stuff, That's not what caused all this.
That's not, okay.
They are just the triggers of
Okay.
things that have been going on for a very long time.
Okay.
And that's what I said is when I go over the x-rays, things will make sense.
Okay.
And my goal for her is to get her in balance.
Mm-hmm.
And if we can get her in balance and get the joints moving, then she can have her quality of life.
Okay.
There are things there I'm not going to fix. I'm telling you right now.
Okay.
Nobody's going to fix it.
No, is it?
No. It's just the wear and tear of the body.
Okay.
Okay, so the idea is we need to fix what we can,
Mm-hmm.
and we need to keep her fine-tuned.
Okay.
What does that mean? So I'm not telling her to stop her work, obviously. And I have several patients that do housekeeping,
Mm-hmm.
and they can't stop their work.
Right.
It just takes that much longer to hold or to find balance.
Mm-hmm.
The fact that she's taking 2 weeks off
Yeah.
is the blessing. Okay,
Yeah.
so hopefully we can get her stabilized and get her functioning and smiling again. You want to smile again? You understand me. You understand. Okay. What else do I need to know about her? Any medications?
No, just for blood pressure.
Okay.
And that's it. Es todo, ¿verdad? ¿Que tomas?
Blood
medicina?
sugar?
Sí,
¿No más pastillas? Es todo.
para la presión y la D3,
And just calcium
que es para los huesos.
for the bones.
Okay.
That's it.
All right, no problem.
Will you explain the parts that you can't, like nobody's gonna fix?
Well, I'm going to go over the x-rays in
Okay.
detail, okay?
Okay.
And if you have questions along the way, just ask.
Okay.
And I'll explain what I see there. And remember, what is the function of this spine? The spine, we all have a spine, right?
Mhm.
We have 24 bones in the spine, 23 discs that move. The spine is there and designed to house and protect the nervous system. And what happens over time when we get these physical traumas
Mhm.
and they build upon each other, things start to wear out.
Okay.
Okay, so we have some wear and tear, we have some calcification
Okay.
going on. That kind of stuff is, the idea is to stop any further progression.
Okay.
Okay?
Okay.
Let's go over your x-rays. This is a picture in time. It tells us how you've evolved from birth, okay?
Okay.
We have 24 bones in the spine that move. We have 23 discs in between. This is our 24-story building. This is our foundation. In order to have a stable building, we need to have a level base and foundation. And on the side profile, what I want us to see is this. We're designed to have 60-degree reciprocating curve. She has no curve in her spine. She's completely straight.
Oh.
And because we don't have the curvature in the spine, what's taking up all the slack? Her low back, right?
Yeah.
And we have some shoulder stuff going on. She has a little bit of anterior head carriage where the neck is in front of the foundation. And we'll get to that stuff later. That's not the primary. Okay? We'll get to that stuff. First thing is, let's go over her foundation and let's see, do we have a level base and foundation? And we'll look at the bone quality and structures. Okay. So the first thing I want us to see here is what? We have a lot of degeneration. You can see these discs, right? You can see how these bones are.
God.
Yeah, so there's,
One's tilted very badly.
they're tilted pretty bad. So what's happened is this first. So first, when we look at the foundation, we can see the hips are a little bit off and they're wearing out a little different. This is wearing out more on the inside here. This is wearing out a little more on the top side there. We have a little bit of bend in the tailbone. But this is all, let me rewind. We have a bend in the tailbone here. We do have good, we can visualize through the sacroiliac joints. That's the good news, so we can see through them. We can see it's a little bit tight in the tops there on both sides. Let's go through the numbers, and this should make a little bit of sense. So what we have going on here is this. We don't have a lot of rotation of her pelvis, okay? We do have a short leg on the left side, 5 MD, a measured difference of 5. The good news is it is under 7. As long as the leg length discrepancy is under 7, adjustments will hold. There's no intervention, there's no lift or anything that we need.
Okay.
The curve of the lumbar spine goes opposite the short leg, so we couldn't put anything in there anyway. But what's more important is now this. So we do have the bend here in the tailbone, okay? It bends right there. And that is what's throwing her left hip off. Then it's compensating here, okay? PI1, IN2 means it's down 1, it's in 2. That's small. I'm not so worried about that. There's no rotation of the sacrum, but there's definitely a bend in the S3, S4, down low in the tailbone. And I'm going to switch to the other x-ray to show you what I'm talking about. So let's look at her tailbone, and this is what I'm talking about here. This should be a smooth arc. We can see a little nub here, but I'm talking about this. And whatever happened here, whatever old tailbone injury, that started a little bit of the process of being off balance. The body has compensated, we get on with life, it's the majority of people. Okay, so let's go back now. So in terms of our foundation, we have something down in the sacrum. Look at L5. L4 disc is thin. You can see that L5 is kind of pancaked. These bones are all kind of, 4 and 5 are kind of squished. And then what happens is this, look. So 4 and 5 are squished, 3 tilts, we have arthritis here. So the body, there's a lot of instability in this part of her back. The disc is good here, disc is good here, disc is good there. That's all good. Disc is good. Instability, so what's the body doing here? This is arthritis or spondylosis. It's because of the instability. It's very stiff in her mid-back. So this is arthritis here, here. All this is the body trying to fuse the instability. Okay? Now, when we get to about the mid-back, this was another side slip or trauma or hit from right to left side. Her upper cervical is good there, so that's the good news there. You'll see a little bit better what I'm talking about here now. When we look at the discs, they are designed to be level and parallel. So you see something like this? Okay, look here. You can see what I'm showing you here? I need you to see this now, man. So if I change the contrast, this is number 5, okay? This is number 4. So something happened in her tailbone, something happened, she has an old fracture of L5. These are old traumas. L4 you can see is kind of squished. L3 is going forward, okay? L3 is going forward, it's trying to fuse there. L2, all this is compensating. But because there's no forward curve, all her pain is coming here in the low back, because that's taking all the weight. Okay. Now, same thing here. This disc is good. This is a little less. There's that hook I'm telling you about. These discs are good. These discs are all good. Okay. Now, she's had a whiplash or whatever neck trauma she had. Her disc is still decent. Okay. If we look at the shape of the bones, what do we see? We see they're kind of concave. So these are old flexion injuries, these are old whiplash injuries, whether it was a car or something else. Okay? These discs are all fine there. Now, let's go back to the full spine and let me talk about what I'm seeing here. So the idea here with your mom is this: we have to stabilize her foundation. Okay? Is this one, look, I need to be clear here. If we can get movement here and here, fantastic. We have to stop any further progression of the degeneration there. Because the only option they're going to tell you is to fuse it all together, put rods in her back.
No, not that.
But through the process, I'm just saying, it's that and or pain meds. So what I would suggest is we'll give her a couple of adjustments. We'll see how we can get her moving. Okay, see how we can get the movement in her spine again. Okay. The sacrum is my focus for her, number 1, and then anything in the mid back and neck that I find I'm okay with. Okay. Does that make sense what I'm saying?
So you're not gonna touch the mid back and the shoulder?
But I'm going to work on everything. But what I'm saying is, if this is calcified and fused, I'm not doing anything for that. But if we get stability in the low back and there's stability in the foundation, then is the body able to handle it and maybe stop or reduce? Yes, absolutely. So if she starts to get cracks and pops in the middle of her back she didn't have in the beginning, before starting, it's a good thing.
Okay.
It's a good thing.
All right.
Okay? And it's going to be a little spicy.
Okay.
That's life. Señora, it's going to be a little spicy, okay? If you are uncomfortable, please let mom know. If she's uncomfortable with anything I'm doing, just tell me to stop.
Okay.
Okay, señora?
Está bien.
¿Lista? ¿Lista? ¿Sí? Bueno. Me too. Turn around. Turn. And what we want to look at is the back first, and we're going to watch the walk, okay? So what we're looking at are the dimples. When she walks, they should go up and down like this.
Okay.
She's from San Miguel, huh? The Valley of the Volcano. Okay, I need her to walk to the corner of the room and back.
Camina a la esquina, mami, y para atrás. Normal. Camina como te sientes.
This is her walk, right?
Yeah.
And you see, turn around
Date vuelta, mami. Y camina otra vez.
and just walk back and
Normal.
forth. Normal. And is she doing that because it hurts?
Yeah, estás caminando así porque te duele, ¿verdad?
Okay.
Yeah.
Keep walking several times back and
Más,
forth.
otra vez lo mismo.
3-4 times.
Otra vez.
Yep, keep going, please. Keep
Continúa,
walking, keep
continúa.
walking, keep walking. Don't stop. Don't stop, please.
Continúa, mami.
Keep walking.
Tiene
Keep.
que ver.
¿Dónde le duele más? Aquí.
Sí.
Okay, caminar. Caminas. So she's got a very choppy walk, right?
Mhm.
You see that?
Yes, I see
Okay.
that.
Keep coming. And what I want you to also notice is that short leg on the left side. That's why she's dropping down.
Oh, okay.
Walk again, please. Watch her left side when she walks. It drops.
Oh, it does
You
that.
see it in the hip how it drops to the left.
Mhm.
Keep walking. Bueno, have a seat over here. Let's get started now.
Siéntate.
Okay, señora. Let's see what we find. Bismillah. Starting at the base of the neck. Relax the hands, please. Right there. Head down. She watch any of my videos? She has no idea what she's getting into. All right. And my question is, why did you decide to come here?
I don't. If I'm being super honest, I really felt that you were gonna make a big difference on her.
Okay, well, hopefully we'll make a difference. Now, and if you were to lie to me, what would you say? You said if you wanted to be perfectly honest. So if you're going to lie to me, what are you going to say? Huh?
Oh no. It's the truth.
Okay.
Complete truth.
15 points up in the penthouse. C1, left side. T5, left side. Let me recheck that again. I think that was a false positive. Yeah, it didn't stop. Kept going. Didn't stop. Kept going. Didn't stop. Kept going. All the way down to the S4 right side. All this is compensation. Even the mid-back. Feet together. Open and close your knees. Yep. Open and close.
Así.
Bueno. Derecho solamente.
Más esta.
Derecho.
Así, más una.
Open, close. Open.
Oh, yeah.
Sí,
derecho,
derecho.
más una.
Derecho. Izquierda
La
solamente.
otra, solita.
Bueno. Derecho. Hips are okay. Scoot back for me, please.
Para atrás, mami.
Para atrás. Bueno. Mira. Número 5. ¿Duele? Número 1.
Dile, mami.
¿Duele?
Sí, ¿te duele o no te duele?
2. ¿Duele?
Más, sí, más o menos.
3. ¿Duele?
Yeah.
Sí.
She's a tough lady, dude. 4. ¿Dónde le duele más? ¿Número 3
Mami,
o
dile.
número 4?
Número 4.
Sí. 4 or 5.
O los dos.
Los dos igual, siento.
The same. Both of them.
Derecho, izquierdo. O izquierda.
Derecho.
Derecho. 5 or 4.
4.
4. Sí.
Respírame.
Sit back para atrás.
Relájate, mami.
Right side, left side. Right side, left side. Mama's in for a treat. Mama is in for a treat today. It's just 2 of you? You have other siblings?
Yes.
Brother,
Yeah,
sister?
I'm the youngest one.
Okay. How many siblings?
We're 10.
Wow.
Yeah, but we're not the same parents.
Okay, that's all right. Aquí,
Ooh.
Sí.
sí. Número 1, duele. Número 2, duele.
Sí.
Número 3,
Sí.
número 4, poco.
Sí.
Número 3, mucho.
Sí.
Número 2, mucho.
Sí.
3,
Sí.
¿dónde le duele más? 2
El 2.
o 3.
El 2.
El 2
Sí.
o 1. Okay. I think we got to do this as a rotated sacrum. I think we need to do this as a critical atlas, but let me check. All right, so we're going to get started on the adjustment now. We're going to do C2 and we're going to do S4 for mom. Okay? And after we do C2 and S4, we're going to have her walk and see what's different. Nice and easy there. Hands on your lap. Hands, both hands. Good. Número 2. Bueno. Número 2. Bueno. Perfecto. Okay, señora. Let's go over here, please. Aquí. You get to help on this one. You've watched the videos, right? All right. Come and hold her legs, please. Come over here on the side. You're going to hold her legs right on the ankles lightly. Catch, don't push. Okay. ¿Lista? 1, 2, 3 y 4. Let's slide her up a little bit more. No, I got her. There we go. Ah! They're perfect. She's good. Hola. Bueno. So that situation isn't anymore, right?
No.
Her situation isn't anymore.
No.
Good. There's 4. So we said we have a short leg on the left side, correct? So what do we want to do? We want to torque it clockwise. Let's go up a little bit, señora. Up. Bueno. We want to torque clockwise to lift that hip on that side. There it goes, right there. Poco. Poco. You got her? Bueno. Home run. Gotcha. Ay, mamá. Respira. Otra vez. Otra vez. Respire. Uno más. Bueno. Hi. Hold my hand, please. Dos manos. Slowly. And let's march in place. Knees up high. Take your time. Look at me. Look at me. Mira yo. Mira yo. Sí. Camina. Good. Good. Okay, señora, now You get to walk.
Ahora camina otra vez.
¿Qué diferente?
Sí,
¿Qué diferente?
¿Qué
me duele menos.
It hurts her less.
Keep walking.
Otra vez, camina.
Hey, she's getting a little pep in her step now.
Continúa para ver pasito.
Hold on one second, señora. Let's see. Hold on. I gotta see if she got that wiggle.
Come on.
Mira. Pretty cool.
Sí, yo siento diferente.
Yeah.
Hmm.
Pero me hizo gritar.
¿Qué?
You
Me
made her
hizo
scream.
gritar.
I made her scream?
Yeah.
Oh, I just getting started. Wait till the next one. Ah. Excelente. Siéntate aquí, por favor. Starting at the base, we did C2. Upper cervical is clear. Very nice. Cleared up the mid-back. All that compensation is clear. Para, para, para. Pow! Mira. Check it out. Come back. Back, 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 back. Número 5. Bueno.
Sí,
Mejor.
sí,
1. Mejor.
sí.
Número 2.
No, ese me duele un poco.
That one still hurts her.
Poco.
Sí.
Mejor.
Es más mejor
¿Qué antes?
que antes?
Sí,
Yeah. It's better from before, but there's still pain.
Sure.
sí.
Número 4.
Sí, un poco menos.
Less, yeah.
3.
Menos.
2.
Ya casi no.
As she walks more, it's going to get less, you'll see.
Ya más que camines, más lo vas a sentir.
Oh,
Fantastic. Now the buff and polish. All right. 5, 4, 3, 2, 1. Now here's the other cool part we're going to check. I didn't touch her shoulder, did I? Ask her to move her shoulders and how they feel. Ask her.
¿Cómo te sientes los hombros? Mueva los hombros.
¿O que los mueva?
Sí, ¿también no te duelen los hombros?
No.
No, pero nothing hurts her.
Y me dolía mucho esto.
Yeah, and that one was hurting her. a lot.
It's not hurting now. We didn't touch her shoulder, did we? Okay, señora, boca arriba, aquí. Boca arriba. Now what's going to be really cool, watch her when she sits up when I'm done. You'll see she gets up easier. Okay, we're going to do your ankles. Left leg up. Bueno. Sit up and turn.
Levántate y date vuelta.
Fácil?
Sí.
Sí. Did I get a smile out of her?
Oh, yes. She's
Huh?
smiling.
How you say smile?
Sonreír.
Sonreír?
Sonreír.
Sonreír. Down, down, down.
Relájate más.
That's it. Ears. Okay. Come over here, please, and let's check the hands. Squeeze my hand. Squeeze. Aprieta. Aprieta. Elbow. Wrist. Squeeze. Relax. Bueno. 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 Aprieta. Aprieta. I want you to walk one more time back and forth, please.
Caminar una vez más, mami.
And you get to come over here and join us so we can...
A ver si me siento bien.
¿Qué?
Me siento como que no soy yo.
Oh, she doesn't feel like herself anymore. She feels like a new person.
Good. Okay. Okay. Bueno?
Sí.
Okay. Do you have any questions for me? Do you understand what I found?
Yes.
So what I found was her sacrum S4, sacrum we're working on, and her C2 up top.
Okay.
As the sacrum gets stable, we'll just take it one visit at a time.
Okay.
I'll see her for about 3 visits over the next week or week and a half, okay? And then we'll make some decisions at the end.
Okay.
Today is Wednesday, so I'm not in tomorrow. I'll see her Friday and Saturday.
Friday and Saturday.
And then we'll regroup either Monday or Tuesday and make some decisions.
Okay.
Fair enough?
Yes.
Señora,
Gracias.
welcome to the office.
Okay.
Bienvenido.
Okay.
Thank you.
Welcome
so
to the
much.
office. You're welcome.